आंसर प्रोपैनोलोल एक्सप्लेनेशन प्रोपैनोलोल बीटा 1 और BETA2 दोनों रिसेप्टर्स ब्लॉक करता है। Q3 Which drug is used antidote in opioid poisoning? A. Naloxone. B. Atropine. C. Flumazenil. D. Physostigmine. Ans. Naloxone. Explanation. Naloxone opioid receptors block करके respiratory depression reverse करता है। Q4 Which antibiotic inhibits bacterial cell wall synthesis? A. Penicillin. B. Tetracycline. C. Chloramphenicol. D. Erythromycin. Ans. Penicillin. Explanation. Penicillin peptidoglycan synthesis रोकता है जिससे bacterial wall टूट जाती है। Q5 Which drug is a loop diuretic? A. Mannitol. B. Hydrochlorothiazide. C. Furosemide. D. Spironolactone. Ans. Furosemide. Explanation. Furosemide loop of Henle में sodium potassium chloride transporter inhibit करता है। Q6 Which drug is used as bronchodilator in asthma? A. Salbutamol. B. Atenolol. C. Enalapril. D. Digoxin. Ans. Salbutamol. Explanation. Salbutamol BETA2 agonist है जो bronchi को relax करता है। Q7 Which drug is a proton pump inhibitor? A. Omeprazole. B. Ranitidine. C. Famotidine. D. Antacid. Ans. Omeprazole. Explanation. Omeprazole gastric acid secretion को irreversibly inhibit करता है। Q8 Which benzodiazepine is commonly used for anxiety? A. Diazepam. B. Aspirin. C. Morphine. D. Paracetamol. Ans. Diazepam. Explanation. Diazepam CNS depressant है और anxiety कम करता है। Q9 Which opioid analgesic is very potent? A. Morphine. B. Aspirin. C. Ibuprofen. D. Diclofenac. Ans. Morphine. Explanation. Morphine severe pain management के लिए यूज होता है। Q10 Which drug is calcium channel blocker? A. Verapamil. B. Losartan. C. Atenolol. D. Digoxin. Ans. Verapamil. Explanation. Verapamil calcium influx block करके BP और heart rate कम करता है। Q11 Which antihistamine is second generation? A. Cetirizine. B. Chlorpheniramine. C. Promethazine. D. Diphenhydramine. Ans. Cetirizine. Explanation. Cetirizine कम sedation करता है क्योंकि brain में कम enter करता है। Q12 Which drug is used in epilepsy? A. Phenytoin. B. Insulin. C. Digoxin. D. Metformin. Ans. Phenytoin. Explanation. Phenytoin sodium channel stabilize करके seizures control करता है। Q13 Which ACE inhibitor is used in hypertension? A. Enalapril. B. Losartan. C. Amlodipine. D. Atenolol. Ans. Enalapril. Explanation. Enalapril angiotensin II formation रोकता है और BP कम करता है। Q14 Which drug belongs to ARB group? A. Losartan. B. Enalapril. C. Digoxin. D. Verapamil. Ans. Losartan. Explanation. Losartan angiotensin II receptor block करता है। Q15 Which anticoagulant acts rapidly? A. Heparin. B. Warfarin. C. Aspirin. D. Clopidogrel. Ans. Heparin. Explanation. Heparin immediate anticoagulant effect देता है। Q16 Which statin reduces cholesterol synthesis? A. Atorvastatin. B. Metformin. C. Insulin. D. Glibenclamide. Ans. Atorvastatin. Explanation. Statins HMG CoA reductase enzyme inhibit करते हैं। Q17 Which drug is first line in type 2 diabetes? A. Metformin. B. Insulin. C. Glympyride. D. Pioglitazone. Ans. Metformin. Explanation. Metformin hepatic glucose production कम करता है। Q18 Which sulfonaloa stimulates insulin release? A. Glibenclamide. B. Metformin. C. Acarbose. D. Pioglitazone. Ans. Glibenclamide. Explanation. Sulfonaloa pancreatic beta cells से insulin release बढ़ाता है। Q19 Which corticosteroid is commonly used in inflammation? A. Prednisolone. B. Ibuprofen. C. Aspirin. D. Morphine. Ans. Prednisolone. Explanation. Prednisolone inflammation और immunity दोनों suppress करता है। Q20 Which anti-TB drug causes peripheral neuropathy? A. Isoniazid. B. Rifampicin. C. Ethambutol. D. Pyrazinamide. Ans. Isoniazid. Explanation. Isoniazid vitamin B6 deficiency से neuropathy कर सकता है। Q21 Which aminoglycoside is nephrotoxic and ototoxic? A. Gentamicin. B. Azithromycin. C. Doxycycline. D. Penicillin. Ans. Gentamicin. Explanation. Gentamicin kidney और ear toxicity कर सकता है। Q22 Which macrolide antibiotic is commonly used in respiratory infections? A. Azithromycin. B. Ciprofloxacin. C. Vancomycin. D. Ceftriaxone. Ans. Azithromycin. Explanation. Azithromycin protein synthesis inhibit करता है। Q23 Which fluoroquinolone inhibits DNA gyrase? A. Ciprofloxacin, B. Penicillin, C. Tetracycline, D. Linezolid. Ans. Ciprofloxacin. Explanation: ciprofloxacin bacterial DNA replication रोकता है. Q24. Which tetracycline commonly causes teeth discoloration? A. Doxycycline, B. Cefixime, C. Vancomycin, D. Rifampicin. Ans. Doxycycline. Explanation: tetracycline children में teeth discoloration काटा है. Q25. Which antifungal inhibits ergosterol synthesis? A. Fluconazole, B. Acyclovir, C. Metronidazole, D. Amoxicillin. Ans. Fluconazole. Explanation: ergosterol inhibition से fungal cell membrane damage होता है. Q26. Which antiviral is used in herpes infection? A. Acyclovir, B. Zidovudine, C. Oseltamivir, D. Lamivudine. Ans. Acyclovir. Explanation: acyclovir viral DNA polymerase inhibit काटा है. Q27. Which antimalarial is used for vivax malaria? A. Chloroquine, B. Penicillin, C. Ciprofloxacin, D. Metformin. Ans. Chloroquine. Explanation: chloroquine malaria parasite को destroy काटा है. Q28. Which antiemetic blocks 5-HT3 receptor? A. Ondansetron, B. Domperidone, C. Metoclopramide, D. Ranitidine. Ans. Ondansetron. Explanation: ondansetron vomiting reflex suppress काटा है. Q29. Which laxative is osmotic in action? A. Lactulose, B. Senus, C. Bisacodyl, D. Loperamide. Ans. Lactulose. Explanation: lactulose intestine में water retention बढ़ाता है. Q30. Which anticholinergic causes pupil dilation? A. Atropine, B. Pilocarpine, C. Physostigmine, D. Neostigmine. Ans. Atropine. Explanation: atropine muscarinic receptors block काटा है. Q31. Which cholinergic agonist is used in glaucoma? A. Pilocarpine, B. Atropine, C. Propanolol, D. Diazepam. Ans. Pilocarpine. Explanation: pilocarpine aqueous humor drainage बढ़ाता है. Q32. Which beta-1 selective blocker is safer in asthma? A. Atenolol, B. Propanolol, C. Timolol, D. Nadolol. Ans. Atenolol. Explanation: atenolol mainly beta-1 receptors block काटा है. Q33. Which nitrate is used in angina? A. Nitroglycerin, B. Digoxin, C. Warfarin, D. Heparin. Ans. Nitroglycerin. Explanation: nitroglycerin vasodilation करके chest pain कम काटा है. Q34. Which cardiac glycoside is used in heart failure? A. Digoxin, B. Diazepam, C. Aspirin, D. Ibuprofen. Ans. Digoxin. Explanation: digoxin heart contraction force बढ़ाता है. Q35. Which local anesthetic blocks sodium channels? A. Lidocaine, B. Morphine, C. Aspirin, D. Diazepam. Ans. Lidocaine. Explanation: lidocaine nerve impulse conduction रोकता है. Q36. Which IV anesthetic is rapidly acting? A. Propofol, B. Ketamine, C. Ether D. Halotone. Ans. Propofol. Explanation: propofol anesthesia induction के लिए rapid action देता है. Q37. Which NSAID has anti-inflammatory effect? A. Ibuprofen, B. Morphine, C. Diazepam, D. Atropine. Ans. Ibuprofen. Explanation: NSAIDs prostaglandin synthesis inhibit करते हैं. Q38. Which antiplatelet irreversibly inhibits COX enzyme? A. Aspirin, B. Clopidogrel, C. Warfarin, D. Heparin. Ans. Aspirin. Explanation: aspirin thromboxane synthesis कम काटा है. Q39. Which thrombolytic dissolves plot? A. Streptokinase, B. Aspirin, C. Heparin, D. Enalapril. Ans. Streptokinase. Explanation: streptokinase fibrin plot breakdown काटा है. Q40. Which immunosuppressant is used after organ transplant? A. Cyclosporine, B. Ibuprofen, C. Aspirin, D. Metformin. Ans. Cyclosporine. Explanation: cyclosporine T cell activation रोकता है. Q41. Which antigout drug inhibits xanthine oxidase? A. Allopurinol, B. Colchicine, C. Aspirin, D. Diclofenac. Ans. Allopurinol. Explanation: allopurinol uric acid formation कम काटा है. Q42. Which bronchodilator is methylxanthine derivative? Theophylline, B. Salbutamol, C. Atenolol, D. Losartan. Ans. Theophylline. Explanation: theophylline bronchi relax काटा है. Q43. Which mucotic breaks mucus? A. Acetylcysteine, B. Diazepam, C. Aspirin, D. Paracetamol. Ans. Acetylcysteine. Explanation: acetylcysteine mucus viscosity कम काटा है. Q44. Which hormone is used in hypothyroidism? A. Levothyroxine. B. Carbimazole. C. Insulin. D. Metformin. Ans. Levothyroxine. Explanation: levothyroxine thyroid hormone replacement therapy है. Q45. Which antithyroid drug inhibits thyroid hormone synthesis? A. Carbimazole. B. Levothyroxine. C. Atenolol. D. Digoxin. Ans. Carbimazole. Explanation: carbimazole thyroid hormone production रोकता है. Q46. Which muscle relaxant acts on spinal cord? A. Baclofen. B. Aspirin. C. Morphine. D. Diazepam. Ans. Baclofen. Explanation: baclofen GABAB agonist hair और muscle spasm कम करता है. Q47. Which SSRI antidepressant is commonly prescribed? A. Fluoxetine. B. Haloperidol. C. Diazepam. D. Lithium. Ans. Fluoxetine. Explanation: fluoxetine serotonin reuptake inhibit करता है. Q48. Which antipsychotic blocks dopamine receptors? A. Haloperidol. B. Fluoxetine. C. Diazepam. D. Paracetamol. Ans. Haloperidol. Explanation: haloperidol schizophrenia treatment में use होता है. Q49. Which drug is used in Alzheimer's disease? A. Donepezil. B. Levodopa. C. Haloperidol. D. Phenytoin. Ans. Donepezil. Explanation: donepezil acetylcholinesterase inhibit करता है. Q50. Which NSAID is safest in children with fever? A. Paracetamol. B. Aspirin. C. Diclofenac. D. Indomethacin. Ans. Paracetamol. Explanation: paracetamol fever और पेन के लिए commonly safe माना जाता है. Q51. Which drug is used as antidote in benzodiazepine poisoning? A. Naloxone. B. Flumazenil. C. Atropine. D. Physostigmine. Ans. Flumazenil. Explanation: flumazenil benzodiazepine receptors block करके overdose reverse करता है. Q52. Which antiarrhythmic drug is also called membrane stabilizer? A. Lidocaine. B. Digoxin. C. Atropine. D. Verapamil. Ans. Lidocaine. Explanation: lidocaine sodium channels block करके arrhythmia control करता है. Q53. Which antiplatelet drug blocks ADP receptor? A. Clopidogrel. B. Aspirin. C. Heparin. D. Warfarin. Ans. Clopidogrel. Explanation: clopidogrel platelet aggregation रोकता है. Q54. Which anticoagulant acts by inhibiting vitamin K? A. Heparin. B. Warfarin. C. Aspirin. D. Streptokinase. Ans. Warfarin. Explanation: warfarin clotting factor synthesis reduce करता है. Q55. Which drug is used in hypertensive emergency? A. Sodium nitroprusside. B. Atenolol. C. Digoxin. D. Aspirin. Ans. Sodium nitroprusside. Explanation: ये rapid vasodilator है जो BP quickly कम करता है. Q56. Which insulin is rapid acting? A. Lispro. B. Glargine. C. Detemir. D. NPH. Ans. Lispro. Explanation: Lispro insulin जल्दी action start करता है और meals के around use होता है. Q57. Which long-acting insulin provides basal control? A. Glargine. B. Regular insulin. C. Lispro. D. Aspart. Ans. Glargine. Explanation: Glargine 24-hour glucose control देता है. Q58. Which oral antidiabetic delays carbohydrate absorption? A. Acarbose. B. Metformin. C. Glibenclamide. D. Pioglitazone. Ans. Acarbose. Explanation: acarbose alpha glucosidase inhibit करता है. Q59. Which drug causes lactic acidosis as rare side effect? A. Metformin. B. Insulin. C. Glimepiride. D. Sitagliptin. Ans. Metformin. Explanation: severe renal disease में metformin lactic acidosis कर सकता है. Q60. Which anti-TB drug causes orange discoloration of urine? A. Rifampicin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Ans. Rifampicin. Explanation: rifampicin body fluids को orange color देता है. Q61. Which anti-TB drug causes optic neuritis? A. Ethambutol. B. Rifampicin. C. Isoniazid. D. Streptomycin. Ans. Ethambutol. Explanation: ethambutol vision disturbance और color blindness कर सकता है. Q62. Which aminoglycoside is mainly used in tuberculosis? A. Streptomycin. B. Gentamicin. C. Amikacin. D. Tobramycin. Ans. Streptomycin. Explanation: streptomycin TB treatment में important drug है. Q63. Which cephalosporin is third generation? A. Ceftriaxone. B. Cephalexin. C. Cefazolin. D. Cefadroxil. Ans. Ceftriaxone. Explanation: ceftriaxone broad spectrum third generation cephalosporin है. Q64. Which antibiotic commonly causes red man syndrome? A. Vancomycin, B. Penicillin, C. Ciprofloxacin, D. Azithromycin. Ans. Vancomycin. Explanation: rapid IV infusion से histamine release होता है. Q65. Which drug is used in MRSA infection? A. Vancomycin, B. Amoxicillin, C. Cefixime, D. Azithromycin. Ans. Vancomycin. Explanation: vancomycin resistant gram-positive bacteria par effective है. Q66. Which antifungal is used in candidiasis? A. Fluconazole, B. Acyclovir, C. Metronidazole, D. Chloroquine. Ans. Fluconazole. Explanation: fluconazole fungal membrane synthesis inhibit करता है. Q67. Which antiviral is used in influenza? A. Oseltamivir, B. Acyclovir, C. Zidovudine, D. Lamivudine. Ans. Oseltamivir. Explanation: oseltamivir neuraminidase inhibitor है. Q68. Which antiretroviral is nucleoside reverse transcriptase inhibitor? A. Zidovudine, B. Ritonavir, C. Nevirapine, D. Efavirenz. Ans. Zidovudine. Explanation: zidovudine HIV replication रोकता है. Q69. Which antimalarial is effective against resistant falciparum malaria? A. Artemether, B. Chloroquine, C. Primecine, D. Quinine. Ans. Artemether. Explanation: artemisinin derivatives severe malaria में effective है. Q70. Which drug is used to eradicate liver hypnozoids in malaria? A. Primecine, B. Chloroquine, C. Artemether, D. Quinine. Ans. Primecine. Explanation: primecine dormant liver forms destroy करता है. Q71. Which antiemetic also increases e-motility? A. Metoclopramide, B. Ondansetron, C. Domperidone, D. Ranitidine. Ans. Metoclopramide. Explanation: ये dopamine antagonist है और gastric emptying बढ़ाता है. Q72. Which antidiarrheal decreases intestinal motility? A. Loperamide, B. Lactulose, C. Senna, D. Bisacodyl. Ans. Loperamide. Explanation: loperamide opioid receptors activate करके diarrhea control करता है. Q73. Which H2 blocker reduces gastric acid secretion? A. Ranitidine, B. Omeprazole, C. Pantoprazole, D. Cyclalphate. Ans. Ranitidine. Explanation: ranitidine histamine H2 receptors block करता है. Q74. Which anti-ulcer drug forms protective coating over ulcer? A. Cyclalphate, B. Omeprazole, C. Ranitidine, D. Famotidine. Ans. Cyclalphate. Explanation: cyclalphate ulcer surface protect करता है. Q75. Which drug is used in inflammatory bowel disease? A. Sulfasalazine, B. Aspirin, C. Diclofenac, D. Ibuprofen. Ans. Sulfasalazine. Explanation: sulfasalazine colon inflammation कम करता है. Q76. Which cholinesterase inhibitor is used in myasthenia gravis? A. Neostigmine, B. Atropine, C. Pilocarpine, D. Propranolol. Ans. Neostigmine. Explanation: neostigmine acetylcholine level बढ़ाता है. Q77. Which adrenergic agonist is used in anaphylactic shock? A. Adrenaline, B. Dopamine, C. Dobutamine, D. Salbutamol. Ans. Adrenaline. Explanation: adrenaline BP और airway दोनों improve करता है. Q78. Which vasopressor is preferred in shock? A. Dopamine, B. Atenolol, C. Verapamil, D. Digoxin. Ans. Dopamine. Explanation: dopamine BP और cardiac output बढ़ाता है. Q79. Which beta-2 agonist is long-acting? A. Salmeterol, B. Salbutamol, C. Terbutaline, D. Adrenaline. Ans. Salmeterol. Explanation: salmeterol long duration bronchodilation देता है. Q80. Which inhaled corticosteroid is commonly used in asthma? A. Budesonide, B. Prednisolone, C. Hydrocortisone, D. Dexamethasone. Ans. Budesonide. Explanation: budesonide airway inflammation reduce करता है. Q81. Which opioid is used for severe chronic pain? A. Phenytoin, B. Aspirin, C. Paracetamol, D. Diclofenac. Ans. Phenytoin. Explanation: phenytoin बहुत potent opioid analgesic है. Q82. Which NSAID preferentially inhibits COX2? A. Celecoxib, B. Aspirin, C. Ibuprofen, D. Ketorolac. Ans. Celecoxib. Explanation: celecoxib gastric irritation कम करता है. Q83. Which drug is antidote for heparin toxicity? A. Protamine sulfate, B. Vitamin K, C. Naloxone, D. Flumazenil. Ans. Protamine sulfate. Explanation: protamine heparin neutralize करता है. Q84. Which vitamin is antidote for warfarin toxicity? A vitamin K, B, vitamin C, C, vitamin D, D, vitamin B12. Ans. Vitamin K. Explanation. Vitamin K clotting factor synthesis restore Carter hair. Q85. Which anticonvulsant is used in status epilepticus? A. Diazepam, B. Carbamazepine, C. Phenytoin, D. Valproate. Ans. Diazepam. Explanation. Diazepam rapid seizure control देता है. Q86. Which anticonvulsant commonly causes gum hyperplasia? A. Phenytoin, B. Valproate, C. Diazepam, D. Phenobarbital. Ans. Phenytoin. Explanation. gingival hyperplasia phenytoin का classic side effect है. Q87. Which mood stabilizer is used in bipolar disorder? A. Lithium, B. Fluoxetine, C. Haloperidol, D. Diazepam. Ans. Lithium. Explanation. Lithium manic episodes control करता है. Q88. Which antipsychotic causes extrapyramidal side effects commonly? A. Haloperidol, B. Clozapine, C. Olanzapine, D. Risperidone. Ans. Haloperidol. Explanation. Dopamine blockade से movement disorders होते हैं. Q89. Which atypical antipsychotic may cause a granulocytosis? A. Clozapine, B. Haloperidol, C. Chlorpromazine, D. Diazepam. Ans. Clozapine. Explanation. Clozapine में WBC monitoring important होता है. Q90. Which antidepressant is tricyclic antidepressant? A. Amitriptyline, B. Fluoxetine, C. Sertraline, D. Escitalopram. Ans. Amitriptyline. Explanation. TCA norepinephrine और serotonin reuptake inhibit करता है. Q91. Which SSRI is commonly used in depression? A. Sertraline, B. Amitriptyline, C. Diazepam, D. Haloperidol. Ans. Sertraline. Explanation. SSRI's depression में first line therapy है. Q92. Which sedative hypnotic acts on GABA receptors? A. Diazepam, B. Aspirin, C. Morphine, D. Paracetamol. Ans. Diazepam. Explanation. Diazepam CNS inhibition बढ़ाता है. Q93. Which drug is used in Alzheimer's disease to improve memory? A. Donepezil, B. Levodopa, C. Carbamazepine, D. Diazepam. Ans. Donepezil. Explanation. Donepezil acetylcholine level increase करता है. Q94. Which drug is used for attention deficit hyperactivity disorder? A. DHD, A. Methylphenidate, B. Haloperidol, C. Diazepam, D. Amitriptyline. Ans. Methylphenidate. Explanation. ये CNS stimulant है जो attention improve करता है. Q95. Which uterotonic drug is used to induce labor? A. Oxytocin, B. Progesterone, C. Estrogen, D. Insulin. Ans. Oxytocin. Explanation. Oxytocin uterine contraction increase करता है. Q96. Which is used as oral contraceptive? A ethical explanation. Estrogen progesterone combination. Q97. Which drug is called the gold standard for treatment of Parkinson's disease? A. Levodopa, B. Diazepam, C. Haloperidol, D. Phenytoin. Ans. Levodopa. Explanation. Levodopa dopamine का precursor है और brain में dopamine बनाकर Parkinson symptoms कम करता है. Q2. Which beta blocker is non-selective? A. Atenolol, B. Propranolol, C. Metoprolol, D. Bisoprolol. Ans. Propranolol. Explanation. Propranolol beta 1 और beta2 दोनों receptors block करता है. Q3. Which drug is used as antidote in opioid poisoning? A. Naloxone, B. Atropine, C. Flumazenil, D. Physostigmine. Ans. Naloxone. Explanation. Naloxone opioid receptors block करके respiratory depression reverse करता है. Q4. Which antibiotic inhibits bacterial cell wall synthesis? A. Penicillin, B. Tetracycline, C. Chloramphenicol, D. Erythromycin. Ans. Penicillin. Explanation. पेनिसिलिन पेप्टाइडोग्लाइकन सिंथेसिस रोकता है जिससे बैक्टीरियल वॉल टूट जाती है. Q5. Which drug is a loop diuretic? A. Mannitol, B. Hydrochlorothiazide, C. Furosemide, spironolactone. Ans. Furosemide. Explanation. Furosemide loop of Henle में sodium potassium chloride transporter inhibit करता है. Q6. Which drug is used as bronchodilator in asthma? A. Salbutamol, C. Enalapril, D. Digoxin. Ans. Salbutamol. Explanation. Salbutamol beta2 agonist है जो bronchi को relax करता है. Which drug is a proton pump inhibitor? A. Omeprazole, B. Ranitidine, C. Famotidine, D. Antacid. Ans. Omeprazole. Explanation: omeprazole gastric acid secretion को irreversibly inhibit करता है. Q8. Which benzodiazepine is commonly used for anxiety? A. Diazepam, B. Aspirin, C. Morphine, D. Paracetamol. Ans. Diazepam. Explanation: diazepam CNS depressant है और anxiety कम करता है. Q9. Which opioid analgesic is very potent? A. Morphine, B. Aspirin, C. Ibuprofen, D. Diclofenac. Ans. Morphine. Explanation: morphine severe pain management के लिए यूज होता है. Q10. Which drug is calcium channel blocker? A. Verapamil, B. Losartan, C. Atenolol, D. Digoxin. Ans. Verapamil. Explanation: verapamil calcium influx block करके BP और heart rate कम करता है. Q11. Which antihistamine is second generation? A. Cetirizine, B. Chlorpheniramine, C. Promethazine, D. Diphenhydramine. Ans. Cetirizine. Explanation: cetirizine कम sedation करता है क्योंकि brain में कम enter करता है. Q12. Which drug is used in epilepsy? Phenytoin, B. Insulin, C. Digoxin, D. Metformin. Ans. Phenytoin. Explanation: phenytoin sodium channel stabilize करके seizures control करता है. Which ACE inhibitor is used in hypertension? A. Enalapril, B. Losartan, C. Amlodipine, D. Atenolol. Ans. Enalapril. Explanation: enalapril angiotensin II formation रोकता है और BP कम करता है. Q14. Which drug belongs to ARB group? A. Losartan, B. Enalapril, C. Digoxin, D. Verapamil. Ans. Losartan. Explanation: losartan angiotensin II receptor block करता है. Q15. Which anticoagulant acts rapidly? A. Heparin, B. Warfarin, C. Aspirin, D. Clopidogrel. Ans. Heparin. Explanation: heparin immediate anticoagulant effect देता है. Q16. Which statin reduces cholesterol synthesis? A. Atorvastatin, B. Metformin, C. Insulin, D. Glibenclamide. Ans. Atorvastatin. Explanation: statins HMG CoA reductase enzyme inhibit करते हैं. Q7. Which drug is first line in type 2 diabetes? A. Metformin, insulin, C. Glimepiride, D. Pioglitazone. Ans. Metformin. Explanation: metformin hepatic glucose production कम करता है. Q18. Which sulfonaloa stimulates insulin release? A. Glibenclamide, B. Metformin, C. Acarbose, D. Pioglitazone. Ans. Glibenclamide. Explanation: sulfonaloa pancreatic beta cells से insulin release बढ़ाता है. Q19. Which corticosteroid is commonly used in inflammation? A. Prednisolone, B. Ibuprofen, C. Aspirin, D. Morphine. Ans. Prednisolone. Explanation: prednisolone inflammation और immunity दोनों suppress करता है. Q20. Anti-TB drug causes peripheral neuropathy. A. Isoniazid, B. Rifampicin, C. Ethambutol, D. Pyrazinamide. Ans. Isoniazid. Explanation: isoniazid vitamin B6 deficiency से neuropathy कर सकता है. Q21. Which aminoglycoside is nephrotoxic and ototoxic? A. Gentamicin, B. Azithromycin, C. Doxycycline, D. Penicillin. Ans. Gentamicin. Explanation: gentamicin kidney और ear toxicity कर सकता है. Q22. Which macrolide antibiotic is commonly used in respiratory infections? A. Azithromycin, B. Ciprofloxacin, C. Vancomycin, D. Ceftriaxone. Ans. Azithromycin. Explanation: azithromycin protein synthesis inhibit करता है. Q23. Which fluoroquinolone inhibits DNA gyrase? A. Ciprofloxacin, B. Penicillin, C. Tetracycline, D. Linezolid. Ans. Ciprofloxacin. Explanation: ciprofloxacin bacterial DNA replication रोकता है. Q24. Which tetracycline commonly causes teeth discoloration? A. Doxycycline, B. Cefixime, C. Vancomycin, D. Rifampicin. Ans. Doxycycline. Explanation: tetracycline children में teeth discoloration करता है. Q25. Which antifungal inhibits ergosterol synthesis? A. Fluconazole, B. Acyclovir, C. Metronidazole, D. Amoxicillin. Ans. Fluconazole. Explanation: ergosterol inhibition से fungal cell membrane damage होता है. Q26. Which antiviral is used in herpes infection? A. Acyclovir, B. Zidovudine, C. Oseltamivir, D. Lamivudine. Ans. Acyclovir. Explanation: acyclovir viral DNA polymerase inhibit करता है. Q27. Which antimalarial is used for vivax malaria? A. Chloroquine, B. Penicillin, C. Ciprofloxacin, D. Metformin. Ans. Chloroquine. Explanation: chloroquine malaria parasite को destroy करता है. Which antiemetic blocks 5-HT3 receptor, A. Ondansetron, B. Domperidone, C. Metoclopramide, D. Ranitidine, ANS. Ondansetron. Explanation: ondansetron vomiting reflex suppress Carter hair. Q29. Which laxative is osmotic in action, A. Lactulose, B. Senus, C. Bisacodyl, D. Loperamide, ANS. Lactulose. Explanation: lactulose intestine में water retention बढ़ाता है. Q30. Which anticholinergic causes pupil dilation, A. Atropine, B. Pilocarpine, C. Physostigmine, D. Neostigmine, ANS. Atropine. Explanation: atropine muscarinic receptors block Carter hair. Q31. Which cholinergic agonist is used in glaucoma, A. Pilocarpine, B. Atropine, C. Propranolol, D. Diazepam, ANS. Pilocarpine. Explanation: pilocarpine aqueous humor drainage बढ़ाता है. Q32. Which beta-1 selective blocker is safer in asthma, A. Atenolol, B. Propranolol, C. Timolol, D. Nadolol, ANS. Atenolol. Explanation: atenolol mainly beta-1 receptors block Carter hair. Q33. Which nitrate is used in angina, A. Nitroglycerin, B. Digoxin, C. Warfarin, D. Heparin, ANS. Nitroglycerin. Explanation: nitroglycerin vasodilation करके chest pain कम Carter hair. Q34. Which cardiac glycoside is used in heart failure, A. Digoxin, B. Diazepam, C. Aspirin, D. Ibuprofen, ANS. Digoxin. Explanation: digoxin heart contraction force बढ़ाता है. Q35. Which local anesthetic blocks sodium channels, A. Lidocaine, B. Morphine, C. Aspirin, D. Diazepam, ANS. Lidocaine. Explanation: lidocaine nerve impulse conduction रोकता है. Q36. Which IV anesthetic is rapidly acting, A. Propofol, B. Ketamine, C. Ether D. Halotone, ANS. Propofol. Explanation: propofol anesthesia induction के लिए rapid action देता है. Q37. Which NSAID has anti-inflammatory effect, A. Ibuprofen, B. Morphine, C. Diazepam, D. Atropine, ANS. Ibuprofen. Explanation: NSAIDs prostaglandin synthesis inhibit करते हैं. Q38. Which antiplatelet irreversibly inhibits COX enzyme, A. Aspirin, B. Clopidogrel, C. Warfarin, D. Heparin, ANS. Aspirin. Explanation: aspirin thromboxane synthesis कम Carter hair. Q39. Which thrombolytic dissolves clot, A. Streptokinase, B. Aspirin, C. Heparin, D. Enalapril, ANS. Streptokinase. Explanation: streptokinase fibrin clot breakdown Carter hair. Q40. Which immunosuppressant is used after organ transplant, A. Cyclosporine, B. Ibuprofen, C. Aspirin, D. Metformin, ANS. Cyclosporine. Explanation: cyclosporine T-cell activation रोकता है. Q41. Which antigout drug inhibits xanthine oxidase, A. Allopurinol, B. Colchicine, C. Aspirin, D. Diclofenac, ANS. Allopurinol. Explanation: allopurinol uric acid formation कम Carter hair. Q42. Which bronchodilator is methylxanthine derivative, A. Theophylline, B. Salbutamol, C. Atenolol, D. Losartan, ANS. Theophylline. Explanation: theophylline bronchi relax Carter hair. Q43. Which mucolytic breaks mucus, A. Acetylcysteine, B. Diazepam, C. Aspirin, D. Paracetamol, ANS. Acetylcysteine. Explanation: acetylcysteine mucus viscosity कम Carter hair. Q44. Which hormone is used in hypothyroidism, A. Levothyroxine, B. Carbimazole, C. Insulin, D. Metformin, ANS. Levothyroxine. Explanation: levothyroxine thyroid hormone replacement therapy है. L. Part 1. Q800. Which drug is commonly used as a proton pump inhibitor for peptic ulcer disease, A. Omeprazole, B. Atenolol, C. Metformin, D. Diazepam, ANS. Omeprazole. Omeprazole irreversibly inhibits the H+, K+ ATPase pump in gastric parietal cells and decreases gastric acid secretion. Q801. Which drug is considered the antidote for opioid overdose, A. Naloxone, B. Atropine, C. Flumazenil, D. Protamine sulfate, ANS. Naloxone. Naloxone is an opioid receptor antagonist that rapidly reverses respiratory depression caused by opioids. Q802. Which antibiotic belongs to the aminoglycoside group, A. Gentamicin, B. Azithromycin, C. Doxycycline, D. Amoxicillin, ANS. Gentamicin. Gentamicin inhibits bacterial protein synthesis by binding to the 30S ribosomal subunit. Q803. Which drug is mainly used for treatment of tuberculosis? A. Rifampicin. B. Ciprofloxacin. C. Penicillin. D. Fluconazole. Ans. Rifampicin. Rifampicin inhibits bacterial RNA polymerase and is a first-line antitubercular drug. Q804. Which drug is a selective beta-1 blocker? A. Atenolol. B. Propanolol. C. Timolol. D. Nadolol. Ans. Atenolol. Atenolol mainly blocks beta-1 receptors in the heart and reduces heart rate and blood pressure. Q805. Which drug is used as a bronchodilator in asthma? A. Salbutamol. B. Enalapril. C. Furosemide. D. Aspirin. Ans. Salbutamol. Salbutamol stimulates beta-2 receptors causing bronchodilation and relief from bronchospasm. Q806. Which drug is a loop diuretic? A. Furosemide. B. Spironolactone. C. Mannitol. D. Hydrochlorothiazide. Ans. Furosemide inhibits sodium and chloride reabsorption in the loop of Henle, producing potent diuresis. Q807. Which drug is used for hypothyroidism? A. Levothyroxine. B. Carbimazole. C. Insulin. D. Prednisolone. Ans. Levothyroxine. Levothyroxine is a synthetic thyroid hormone used to replace deficient thyroxine. Q808. Which drug is an H1 antihistamine? A. Cetirizine. B. Omeprazole. C. Digoxin. D. Atropine. Ans. Cetirizine blocks histamine H1 receptors and is used in allergic conditions. Q809. Which drug is used as an anticoagulant? A. Heparin. B. Aspirin. C. Clopidogrel. D. Paracetamol. Ans. Heparin enhances antithrombin 3 activity and prevents blood clot formation. Q810. Which drug is used in Parkinson's disease? A. Levodopa. B. Diazepam. C. Haloperidol. D. Phenytoin. Ans. Levodopa. Levodopa is converted to dopamine in the brain and improves motor symptoms of Parkinsonism. Q811. Which drug is a calcium channel blocker? A. Verapamil. B. Losartan. C. Atenolol. D. Enalapril. Ans. Verapamil blocks calcium influx into cardiac and smooth muscle cells, reducing blood pressure. Q812. Which drug belongs to the benzodiazepine class? A. Diazepam. B. Morphine. C. Aspirin. D. Digoxin. Ans. Diazepam enhances GABA activity, producing anxiolytic and sedative effects. Q813. Which drug is used in gout to decrease uric acid production? A. Allopurinol. B. Ibuprofen. C. Prednisolone. D. Metformin. Ans. Allopurinol inhibits xanthine oxidase enzyme and decreases uric acid synthesis. Q814. Which drug is an opioid analgesic? A. Morphine. B. Aspirin. C. Ibuprofen. D. Diclofenac. Ans. Morphine acts on opioid receptors in the CNS to produce strong analgesia. Q815. Which drug is commonly used as an antiepileptic agent? A. Phenytoin. B. Atenolol. C. Digoxin. D. Omeprazole. Ans. Phenytoin stabilizes neuronal membranes by blocking sodium channels. Q816. Which drug is used in diabetes mellitus as a biguanide? A. Metformin. B. Glibenclamide. C. Insulin. D. Pioglitazone. Ans. Metformin decreases hepatic glucose production and improves insulin sensitivity. Q817. Which drug is a corticosteroid? A. Prednisolone. B. Aspirin. C. Paracetamol. D. Diazepam. Ans. Prednisolone suppresses inflammation and immune responses. Q818. Which drug is used as an antiemetic? A. Ondansetron. B. Lactulose. C. Omeprazole. D. Aspirin. Ans. Ondansetron blocks 5-HT3 receptors and prevents nausea and vomiting. Q819. Which drug is used in fungal infections? A. Fluconazole. B. Acyclovir. C. Rifampicin. D. Ciprofloxacin. Ans. Fluconazole inhibits fungal ergosterol synthesis and damages fungal cell membranes. Q820. Which drug is an antiviral agent used in herpes infection? A. Acyclovir. B. Metronidazole. C. Doxycycline. D. Ceftriaxone. Ans. Acyclovir inhibits viral DNA polymerase and prevents viral replication. Q821. Which drug belongs to the tetracycline group? A. Doxycycline. B. Azithromycin. C. Amoxicillin. D. Gentamicin. Ans. Doxycycline inhibits bacterial protein synthesis by binding to the 30S ribosome. Q822. Which drug is commonly used as a thrombolytic agent? A. Streptokinase. B. Heparin. C. Aspirin. D. Clopidogrel. Uns. Streptokinase converts plasminogen to plasmin and dissolves blood clots. Q823. Which drug is an ACE inhibitor? A. Enalapril. B. Losartan. C. Amlodipine. D. Propanolol. Uns. Enalapril inhibits angiotensin converting enzyme and lowers blood pressure. Q824. Which drug is an angiotensin receptor blocker? A. Losartan. B. Enalapril. C. Verapamil. D. Digoxin. Uns. Losartan blocks angiotensin 2 receptors and reduces vasoconstriction. Q825. Which drug is commonly used as a local anesthetic? A. Lidocaine. B. Morphine. C. Aspirin. D. Propofol. Uns. Lidocaine blocks sodium channels and prevents nerve impulse conduction. Q826. Which drug is used in hypothyroidism? A. Carbimazole. B. Levothyroxine. C. Prednisolone. D. Metformin. Uns. Carbimazole inhibits thyroid hormone synthesis in the thyroid gland. Q827. Which drug is an NSAID? A. Ibuprofen. B. Morphine. C. Diazepam. D. Atropine. Uns. Ibuprofen inhibits cyclooxygenase enzyme and decreases prostaglandin synthesis. Q828. Which drug is a cardiac glycoside? A. Digoxin. B. Atenolol. C. Verapamil. D. Losartan. Uns. Digoxin increases force of cardiac contraction by inhibiting Na plus K plus ATPase. Q829. Which drug is commonly used as a laxative? A. Lactulose. B. Ondansetron. C. Omeprazole. D. Atropine. Uns. Lactulose increases osmotic pressure in the bowel and promotes defecation. Q830. Which drug is used in malaria treatment? A. Chloroquine. B. Penicillin. C. Gentamicin. D. Fluconazole. Uns. Chloroquine interferes with parasite heme metabolism causing parasite death. Q831. Which drug is an antiplatelet agent? A. Aspirin. B. Heparin. C. Warfarin. D. Morphine. Uns. Aspirin irreversibly inhibits cyclooxygenase and prevents platelet aggregation. Q832. Which drug belongs to the macrolide antibiotic group? A. Azithromycin. B. Ciprofloxacin. C. Doxycycline. D. Ceftriaxone. Uns. Azithromycin inhibits bacterial protein synthesis by acting on the 50S ribosome. Q833. Which drug is a proton pump inhibitor? A. Pantoprazole. B. Ranitidine. C. Famotidine. D. Cimetidine. Uns. Pantoprazole suppresses gastric acid secretion by inhibiting the proton pump. Q834. Which drug is used in motion sickness? A. Hyoscine. B. Metformin. C. Digoxin. D. Aspirin. Uns. Hyoscine blocks muscarinic receptors and prevents nausea associated with motion sickness. Q835. Which drug is used in Alzheimer's disease? A. Donepezil. B. Haloperidol. C. Diazepam. D. Phenytoin. Uns. Donepezil inhibits acetylcholinesterase and increases acetylcholine levels in the brain. Q836. Which drug is a muscle relaxant? A. Baclofen. B. Aspirin. C. Omeprazole. D. Digoxin. Uns. Baclofen acts on GABA receptors and reduces skeletal muscle spasticity. Q837. actively inhibits serotonin reuptake in the CNS. Q838. Which drug is an antipsychotic? A. Haloperidol. B. Fluoxetine. C. Diazepam. D. Paracetamol. Ans. Haloperidol. Haloperidol blocks dopamine receptors and is used in psychotic disorders. Q839. Which drug is used as a mucolytic agent? A. Acetylcysteine. B. Cetirizine. C. Atropine. D. Prednisolone. Ans. Acetylcysteine. Acetylcysteine breaks disulfide bonds in mucus and decreases sputum viscosity. Q840. Which drug is commonly used in heart failure? A. Digoxin. B. Diazepam. C. Omeprazole. D. Ibuprofen. Ans. Digoxin. Digoxin improves cardiac output, increasing myocardial contractility. Q841. Which drug is an immunosuppressant? A. Cyclosporine. B. Aspirin. C. Ibuprofen. D. Paracetamol. Ans. Cyclosporine. Cyclosporine suppresses T cell activation and prevents organ rejection. Q842. Which drug is a sulfonylurea antidiabetic drug? A. Glibenclamide. B. Metformin. C. Insulin. D. Acarbose. Ans. Glibenclamide. Glibenclamide stimulates insulin release from pancreatic beta cells. Q843. Which drug is a fluoroquinolone antibiotic? A. Ciprofloxacin. B. Penicillin. C. Azithromycin. D. Vancomycin. Ans. Ciprofloxacin. Ciprofloxacin inhibits bacterial DNA gyrase enzyme. Q844. Which drug is used as an anticholinergic? A. Atropine. B. Pilocarpine. C. Neostigmine. D. Physostigmine. Ans. Atropine. Atropine blocks muscarinic acetylcholine receptors. Q845. Which drug is a cholinergic agonist? A. Pilocarpine. B. Atropine. C. Propranolol. D. Diazepam. Ans. Pilocarpine. Pilocarpine stimulates muscarinic receptors and increases secretions. Q846. Which drug is commonly used in angina pectoris? A. Nitroglycerin. B. Digoxin. C. Atenolol. D. Metformin. Nitroglycerin. Nitroglycerin causes vasodilation and decreases cardiac oxygen demand. Q847. Which drug is used as a general anesthetic? A. Propofol. B. Lidocaine. C. Aspirin. D. Morphine. Ans. Propofol. Propofol enhances GABA activity causing rapid induction of anesthesia. Q848. Which drug is an anaphylactic shock? A. Adrenaline. B. Atenolol. C. Digoxin. D. Verapamil. Ans. Q8. Q804. Q1. Which drug is called the gold standard inflammatory effect? A. Ibuprofen. B. Morphine. C. Diazepam. D. Atropine. Ans. Ibuprofen. Explanation: NSAIDs prostaglandin synthesis inhibit करते हैं. Q38. Which antiplatelet irreversibly inhibits COX enzyme? A. Aspirin. B. Clopidogrel. C. Warfarin. D. Heparin. Ans. Aspirin. Explanation: aspirin thromboxane synthesis कम करता है. Q39. Which thrombolytic dissolves clot? A. Streptokinase. B. Aspirin. C. Heparin. D. Enalapril. Ans. Streptokinase. Explanation: streptokinase fibrin clot breakdown करता है. Q40. Which immunosuppressant is used after organ transplant? A. Cyclosporine. B. Ibuprofen. C. Aspirin. D. Metformin. Ans. Cyclosporine. Explanation: cyclosporine T cell activation रोकता है. Which immunosuppressant is used after organ transplant? A. Cyclosporine. B. Ibuprofen. C. Aspirin. D. Metformin. Ans. Cyclosporine. Explanation: cyclosporine T cell activation रोकता है. Q41. Which antigout drug inhibits xanthine oxidase? A. Allopurinol. B. Colchicine. C. Aspirin. D. Diclofenac. Ans. Allopurinol. Explanation: allopurinol uric acid formation कम करता है. Q42. Which bronchodilator is methylxanthine derivative? A. Theophylline. B. Salbutamol. C. Atenolol. D. Losartan. Ans. Theophylline. Explanation: theophylline bronchi relax करता है. Q43. Which mucolytic breaks mucus? A. Acetylcysteine. B. Diazepam. C. Aspirin. D. Paracetamol. Ans. Acetylcysteine. Explanation: acetylcysteine mucus viscosity कम करता है. Q44. Which hormone is used in hypothyroidism? A. Levothyroxine. B. Carbimazole. C. Insulin. D. Metformin. Ans. Levothyroxine. Explanation: levothyroxine thyroid hormone replacement therapy hai. L. Part 1. Q800. Which drug is commonly used as a proton pump inhibitor for peptic ulcer disease? A. Omeprazole. B. Atenolol. C. Metformin. D. Diazepam. Ans. Omeprazole irreversibly inhibits the H plus K plus ATPase pump in gastric parietal cells and decreases gastric acid secretion. Q801. Which drug is considered the antidote for opioid overdose? A. Naloxone. B. Atropine. C. Flumazenil. D. Protamine sulfate. Ans. Naloxone. Naloxone is an opioid receptor antagonist that rapidly reverses respiratory depression caused by opioids. Q802. Which antibiotic belongs to the aminoglycoside group? A. Gentamicin. B. Azithromycin. C. Doxycycline. D. Amoxicillin. Ans. Gentamicin. Gentamicin inhibits bacterial protein synthesis by binding to the 30S ribosomal subunit. Q803. Which drug is mainly used for treatment of tuberculosis? A. Rifampicin. B. Ciprofloxacin. C. Penicillin. D. Fluconazole. Ans. Rifampicin inhibits bacterial RNA polymerase and is a first-line antitubercular drug. Q804. Which drug is a selective beta-1 blocker? A. Atenolol. B. Propanolol. C. Timolol. D. Nadolol. Ans. Atenolol mainly blocks beta-1 receptors in the heart and reduces heart rate and blood pressure. Q805. Which drug is used as a bronchodilator in asthma? A. Salbutamol. B. Enalapril. C. Furosemide. D. Aspirin. Ans. Salbutamol stimulates beta-2 receptors causing bronchodilation and relief from bronchospasm. Q806. Which drug is a loop diuretic? A. Furosemide. B. Spironolactone. C. Mannitol. D. Hydrochlorothiazide. Ans. Furosemide inhibits sodium and chloride reabsorption in the loop of Henle, producing potent diuresis. Q807. Which drug is used for hypothyroidism? A. Levothyroxine. B. Carbimazole. C. Insulin. D. Prednisolone. Ans. Levothyroxine is a synthetic thyroid hormone used to replace deficient thyroxine. Q808. Which drug is an H1 antihistamine? A. Cetirizine. B. Omeprazole. C. Digoxin. D. Atropine. Ans. Cetirizine blocks histamine H1 receptors and is used in allergic conditions. Q809. Which drug is used as an anticoagulant? A. Heparin. B. Aspirin. C. Clopidogrel. D. Paracetamol. Ans. Heparin enhances antithrombin 3 activity and prevents blood clot formation. Q810. Which drug is used in Parkinson's disease? A. Levodopa. B. Diazepam. C. Haloperidol. D. Phenytoin. Ans. Levodopa is converted to dopamine in the brain and improves motor symptoms of Parkinsonism. Q811. Which drug is a calcium channel blocker? A. Verapamil. B. Losartan. C. Atenolol. D. Enalapril. Ans. Verapamil blocks calcium influx into cardiac and smooth muscle cells, reducing blood pressure. Q812. Which drug belongs to the benzodiazepine class? A. Diazepam. B. Morphine. C. Aspirin. D. Digoxin. Ans. Diazepam enhances GABA activity, producing anxiolytic and sedative effects. Q813. Which drug is used in gout to decrease uric acid production? A. Allopurinol. B. Ibuprofen. C. Prednisolone. D. Metformin. Ans. Allopurinol inhibits xanthine oxidase enzyme and decreases uric acid synthesis. Q814. Which drug is an opioid analgesic? A. Morphine. B. Aspirin. C. Ibuprofen. D. Diclofenac. Ans. Morphine acts on opioid receptors in the CNS to produce strong analgesia. Q815. Which drug is commonly used as an antiepileptic agent? A. Phenytoin. B. Atenolol. C. Digoxin. D. Omeprazole. Ans. Phenytoin stabilizes neuronal membranes by blocking sodium channels. Q816. Which drug is used in diabetes mellitus as a biguanide? A. Metformin. B. Glibenclamide. C. Insulin. D. Pioglitazone. Ans. Metformin decreases hepatic glucose production and improves insulin sensitivity. Q817. Which drug is a corticosteroid? A. Prednisolone. B. Aspirin. C. Paracetamol. D. Diazepam. Ans. Prednisolone suppresses inflammation and immune responses. Q818. Which drug is used as an antiemetic? A. Ondansetron. B. Lactulose. C. Omeprazole. D. Aspirin. Ans. Ondansetron blocks 5-HT3 receptors and prevents nausea and vomiting. Q819. Which drug is used in fungal infections? A. Fluconazole. B. Acyclovir. C. Rifampicin. D. Ciprofloxacin. Ans. Fluconazole. Fluconazole inhibits fungal ergosterol synthesis and damages fungal cell membranes. Q820. Which drug is an antiviral agent used in herpes infection? A. Acyclovir. B. Metronidazole. C. Doxycycline. D. Ceftriaxone. Ans. Acyclovir inhibits viral DNA polymerase and prevents viral replication. Q821. Which drug belongs to the tetracycline group? A. Doxycycline. B. Azithromycin. C. Amoxicillin. D. Gentamicin. Ans. Doxycycline inhibits bacterial protein synthesis by binding to the 30S ribosome. Q822. Which drug is commonly used as a thrombolytic agent? A. Streptokinase. B. Heparin. C. Aspirin. D. Clopidogrel. Ans. Streptokinase converts plasminogen to plasmin and dissolves blood clots. Q823. Which drug is an ACE inhibitor? A. Enalapril. B. Losartan. C. Amlodipine. D. Propanolol. Ans. Enalapril inhibits angiotensin converting enzyme and lowers blood pressure. Q824. Which drug is an angiotensin receptor blocker? A. Losartan. B. Enalapril. C. Verapam. D. Digoxin. Ans. Losartan blocks angiotensin 2 receptors and reduces vasoconstriction. Q825. Which drug is commonly used as a local anesthetic? A. Lidocaine. B. Morphine. C. Aspirin. D. Propofol. Ans. Lidocaine blocks sodium channels and prevents nerve impulse conduction. Q826. Which drug is used in hypothyroidism? A. Carbimazole. B. Levothyroxine. C. Prednisolone. D. Metformin. Ans. Carbimazole inhibits thyroid hormone synthesis in the thyroid gland. Q827. Which drug is an NSAID? A. Ibuprofen. B. Morphine. C. Diazepam. D. Atropine. Ans. Ibuprofen inhibits cyclooxygenase enzyme and decreases prostaglandin synthesis. Q828. Which drug is a cardiac glycoside? A. Digoxin. B. Atenolol. C. Verapamil. D. Losartan. Ans. Digoxin increases force of cardiac contraction by inhibiting Na plus K plus at pace. Q829. Which drug is commonly used as a laxative? A. Lactulose. B. Ondansetron. C. Omeprazole. D. Atropine. Ans. Lactulose increases osmotic pressure in the bowel and promotes defecation. Q830. Which drug is used in malaria treatment? A. Chloroquine. B. Penicillin. C. Gentamicin. D. Fluconazole. Ans. Chloroquine interferes with parasite heme metabolism causing parasite death. Q831. Which drug is an antiplatelet agent? A. Aspirin. B. Heparin. C. Warfarin. D. Morphine. Ans. Aspirin irreversibly inhibits cyclooxygenase and prevents platelet aggregation. Q832. Which drug belongs to the macrolide antibiotic group? A. Azithromycin. B. Ciprofloxacin. C. Doxycycline. D. Ceftriaxone. Ans. Azithromycin inhibits bacterial protein synthesis by acting on the 50S ribosome. Q833. Which drug is a proton pump inhibitor? A. Pantoprazole. B. Ranitidine. C. Famotidine. D. Cimetidine. Ans. Pantoprazole suppresses gastric acid secretion by inhibiting the proton pump. Q834. Which drug is used in motion sickness? A. Hyoscine. B. Metformin. C. Digoxin. D. Aspirin. Ans. Hyoscine blocks muscarinic receptors and prevents nausea associated with motion sickness. Q835. Which drug is used in Alzheimer's disease? A. Donepezil. B. Haloperidol. C. Diazepam. D. Phenytoin. Ans. Donepezil inhibits acetylcholinesterase and increases acetylcholine levels in the brain. Q836. Which drug is a muscle relaxant? A. Baclofen. B. Aspirin. C. Omeprazole. D. Digoxin. Ans. Baclofen acts on GABA receptors and reduces skeletal muscle spasticity. Q837. Which drug is commonly used as an antidepressant? SSRI. A. Fluoxetine. B. Diazepam. C. Haloperidol. D. Morphine. Ans. Fluoxetine selectively inhibits serotonin reuptake in the CNS. Q838. Which drug is an antipsychotic? A. Haloperidol. B. Fluoxetine. C. Diazepam. D. Paracetamol. Ans. Haloperidol. Haloperidol blocks dopamine receptors and is used in psychotic disorders. Q839. Which drug is used as a mucolytic agent? A. Acetylcysteine. B. Cetirizine. C. Atropine. D. Prednisolone. Ans. Acetylcysteine. Acetylcysteine breaks disulfide bonds in mucus and decreases sputum viscosity. Q840. Which drug is commonly used in heart failure? A. Digoxin. B. Diazepam. C. Omeprazole. D. Ibuprofen. Ans. Digoxin. Digoxin improves cardiac output by increasing myocardial contractility. Q841. Which drug is an immunosuppressant? A. Cyclosporine. B. Aspirin. C. Ibuprofen. D. Paracetamol. Ans. Cyclosporine. Cyclosporine suppresses T cell activation and prevents organ rejection. Q842. Which drug is a sulfonylurea antidiabetic drug? A. Glibenclamide. B. Metformin. C. Insulin. D. Acarbose. Ans. Glibenclamide. Glibenclamide stimulates insulin release from pancreatic beta cells. 143. Which drug is a fluoroquinolone antibiotic? A. Ciprofloxacin. B. Penicillin. C. Azithromycin. D. Vancomycin. Ans. Ciprofloxacin. Ciprofloxacin inhibits bacterial DNA gyrase enzyme. Q844. Which drug is used as an anticholinergic? A. Atropine. B. Pilocarpine. C. Neostigmine. D. Physostigmine. Ans. Atropine. Atropine blocks muscarinic acetylcholine receptors. Q845. Which drug is a cholinergic agonist? A. Pilocarpine. B. Atropine. C. Propanolol. D. Diazepam. Ans. Pilocarpine. Pilocarpine stimulates muscarinic receptors and increases secretions. Q846. Which drug is commonly used in angina pectoris? A. Nitroglycerin. B. Digoxin. C. Atenolol. D. Metformin. Ans. Nitroglycerin. Nitroglycerin causes vasodilation and decreases cardiac oxygen demand. Q847. Which drug is used as a general anesthetic? A. Propofol. B. Lidocaine. C. Aspirin. D. Morphine. Ans. Propofol. Propofol enhances GABA activity causing rapid induction of anesthesia. Q848. Which drug is used in anaphylactic shock? A. Adrenaline. B. Atenolol. C. Digoxin. D. Verapamil. Ans. Adrenaline. Adrenaline stimulates alpha and beta receptors and rapidly reverses bronchospasm and hypotension. 49. Which drug is used in iron deficiency anemia? A. Ferrous sulfate. B. Calcium carbonate. C. Magnesium sulfate. D. Sodium bicarbonate. Ans. Ferrous sulfate. Ferrous sulfate provides elemental iron necessary for hemoglobin synthesis. Q850. Which drug is commonly used for osteoporosis? A. Alendronate. B. Prednisolone. C. Aspirin. D. Diazepam. Ans. Alendronate. Alendronate inhibits osteoclast activity and decreases bone resorption. Q850. Which drug is commonly used for osteoporosis? A. Alendronate. B. Prednisolone. C. Aspirin. D. Diazepam. Ans. Alendronate. Alendronate inhibits osteoclast activity and decreases bone resorption. Q851. Which drug is used as an antidote for heparin toxicity? A. Protamine sulfate. B. Naloxone. C. Atropine. D. Vitamin K. Ans. Protamine sulfate. Protamine sulfate neutralizes the anticoagulant effect of heparin. Q852. Which vitamin is commonly used in megaloblastic anemia? A. Folic acid. B. Vitamin C. Vitamin D. D. Vitamin K. Ans. Folic acid. Folic acid is essential for DNA synthesis and red blood cell maturation. Q853. Which drug is a potassium-sparing diuretic? A. Spironolactone. B. Furosemide. C. Mannitol. D. Hydrochlorothiazide. Ans. Spironolactone. Spironolactone antagonizes aldosterone receptors and conserves potassium. Q854. Which drug is used for emergency treatment of hypoglycemia? A. Glucagon. B. Insulin. C. Metformin. D. Pioglitazone. Ans. Glucagon. Glucagon raises blood glucose by stimulating glycogen breakdown in the liver. Q855. Which drug is used as a first-line treatment in hypertension? A. Amlodipine. B. Adrenaline. C. Dopamine. D. Atropine. Ans. Amlodipine. Amlodipine blocks calcium channels and causes vasodilation. Q856. Which drug is commonly used in bipolar disorder? A. Lithium. B. Diazepam. C. Fluoxetine. D. Haloperidol. Ans. Lithium. Lithium stabilizes mood and is used in manic depressive illness. Q. 857. Which drug is an antifolate antimalarial drug? A. Pyrimethamine. B. Chloroquine. C. Primaquine. D. Quinine. Ans. Pyrimethamine. Pyrimethamine inhibits folic acid synthesis in malarial parasites. Q. 858. Which drug is used in acute asthma attack? A. Salbutamol. B. Propanolol. C. Atenolol. D. Digoxin. Ans. Salbutamol. Salbutamol rapidly relaxes bronchial smooth muscle through beta-2 stimulation. Q. 859. Which drug is a first-generation antihistamine? A. Chlorpheniramine. B. Cetirizine. C. Loratadine. D. Fexofenadine. Ans. Chlorpheniramine. Chlorpheniramine blocks H1 receptors and commonly causes sedation. Q. 860. Which drug is used for organ transplant rejection prevention? A. Tacrolimus. B. Paracetamol. C. Aspirin. D. Ibuprofen. Ans. Tacrolimus. Tacrolimus suppresses T lymphocyte activation and prevents graft rejection. Q. 861. Which drug is used as an antithyroid agent? A. Propylthiouracil. B. Levothyroxine. C. Insulin. D. Metformin. Ans. Propylthiouracil. Propylthiouracil inhibits thyroid hormone synthesis and peripheral conversion of T4 to T3. Q. 862. Which drug is a cephalosporin antibiotic? A. Ceftriaxone. B. Doxycycline. C. Azithromycin. D. Ciprofloxacin. Ans. Ceftriaxone. Ceftriaxone inhibits bacterial cell wall synthesis. Q. 863. Which drug is commonly used in rheumatoid arthritis? A. Methotrexate. B. Omeprazole. C. Digoxin. D. Diazepam. Ans. Methotrexate. Methotrexate suppresses immune activity and reduces joint inflammation. Q. 864. Which drug is used in status epilepticus? A. Diazepam. B. Atenolol. C. Aspirin. D. Metformin. Ans. Diazepam. Diazepam enhances GABA activity and rapidly controls seizures. Q. 865. Which drug is an osmotic diuretic? A. Mannitol. B. Furosemide. C. Spironolactone. D. Hydrochlorothiazide. Ans. Mannitol. Mannitol increases osmotic pressure and promotes water excretion. Q. 866. Which drug is commonly used in glaucoma? A. Timolol. B. Atenolol. C. Propanolol. D. Digoxin. Ans. Timolol. Timolol decreases aqueous humor production and lowers intraocular pressure. Q. 867. Which drug is used as an antiplatelet agent after myocardial infarction? A. Clopidogrel. B. Heparin. C. Warfarin. D. Morphine. Ans. Clopidogrel. Clopidogrel inhibits ADP-induced platelet aggregation. Q. 868. Which drug is a selective serotonin reuptake inhibitor? A. Sertraline. B. Haloperidol. C. Diazepam. D. Lithium. Ans. Sertraline. Sertraline increases serotonin levels in the CNS and is used in depression. Q. 869. Which drug is used for fungal skin infection? A. Clotrimazole. B. Acyclovir. C. Penicillin. D. Ciprofloxacin. Ans. Clotrimazole. Clotrimazole damages fungal cell membrane by inhibiting ergosterol synthesis. Q. 870. Which drug is used as an antiarrhythmic agent? A. Amiodarone. B. Aspirin. Metformin. D. Omeprazole. Ans. Amiodarone. Amiodarone prolongs cardiac action potential, stabilizes abnormal rhythms. Q. 871. Which drug is used in peptic ulcer disease as an H2 blocker? A. Ranitidine. B. Omeprazole. C. Pantoprazole. D. Antacid. Ans. Ranitidine. Ranitidine blocks histamine H2 receptors and decreases gastric acid secretion. Q. 872. Which drug is commonly used in migraine prophylaxis? A. Propanolol. B. Salbutamol. C. Adrenaline. D. Dopamine. Ans. Propanolol. Propanolol reduces frequency of migraine attacks by beta blockade. Q. 873. Which drug is used for opioid dependence treatment? A. Methadone. B. Diazepam. C. Aspirin. D. Digoxin. Ans. Methadone. Methadone is a long-acting opioid used in opioid substitution therapy. Q. 874. Which drug is used in constipation as a bulk laxative? A. Psyllium. B. Lactulose. C. Senna. D. Bisacodyl. Ans. Psyllium. Psyllium absorbs water and increases stool bulk. Q. 875. Which drug is a carbonic anhydrase inhibitor? A. Acetazolamide. B. Furosemide. C. Mannitol. D. Spironolactone. Acetazolamide. Acetazolamide inhibits carbonic anhydrase enzyme and reduces bicarbonate reabsorption. Q876. Which drug is used in ventricular tachycardia? A. Lidocaine. B. Omeprazole. C. Aspirin. D. Cetirizine. Lidocaine. Lidocaine suppresses abnormal ventricular electrical activity. Q877. Which drug is commonly used in COPD management? A. Tiotropium. B. Atenolol. C. Digoxin. D. Metformin. Tiotropium. Tiotropium is a long-acting anticholinergic bronchodilator. Q878. Which drug is used in anaphylaxis to improve blood pressure? A. Adrenaline. B. Propranolol. C. Verapamil. D. Aspirin. Adrenaline. Adrenaline stimulates alpha receptors causing vasoconstriction and increased blood pressure. Q879. Which drug is a broad-spectrum penicillin? A. Amoxicillin. B. Ciprofloxacin. Cyclin. D. Azithromycin. Amoxicillin. Amoxicillin inhibits bacterial cell wall synthesis and acts against many bacteria. Q880. Which drug is used in tuberculosis causing orange discoloration of urine? A. Rifampicin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Rifampicin commonly causes orange-red discoloration of body fluids. Q881. Which drug is used as a sedative hypnotic? A. Phenobarbital. B. Aspirin. C. Metformin. D. Omeprazole. Phenobarbital depresses CNS activity and induces sleep. Q882. Which drug is commonly used for nausea during chemotherapy? A. Ondansetron. B. Lactulose. C. Digoxin. D. Aspirin. Ondansetron blocks serotonin receptors involved in vomiting reflex. Q883. Which drug is used in type 1 diabetes mellitus? A. Insulin. B. Metformin. C. Glibenclamide. D. Pioglitazone. Insulin replaces deficient endogenous insulin in type 1 diabetes. Q884. Which drug is used as an antifungal in candidiasis? A. Nystatin. B. Acyclovir. C. Ciprofloxacin. D. Doxycycline. Nystatin binds fungal cell membrane sterol contents. paracetamol, C. aspirin, D. ibuprofen. Ans. Morphine acts on opioid receptors, producing strong analgesic effect. 886. Which drug is commonly used in anxiety disorder? A. Alprazolam, B. Digoxin, C. Aspirin, D. Omeprazole. Ans. Alprazolam enhances GABA-mediated CNS inhibition and reduces anxiety. Q 887. Which drug is used in iron overdose poisoning? A. Deferoxamine, B. Naloxone, C. Atropine, D. Vitamin K. Deferoxamine chelates excess iron and promotes its excretion. Q 888.
আর ছুটি
Which
ভালো
drug
লাগছে
is
ভালো
used as
লাগছে
an anticonvulsivant agent? A. Metronidazole,
আর
B.
ছুটি যে ভালো
Penicillin,
লাগছে
C. Ceftriaxone, D. Azithromycin.
বেল পেঁপে থেকে যাওয়া হচ্ছে
Metronidazole
কত
damages
জানা
DNA of anaerobic organisms and protozoa. Q 889.
তুমি
Which
সোজা
drug
তো
is
সরলা না
used in
বেলে
hyperlipidemia?
যাও
A. Rosuvastatin, B. Metformin, C. Omeprazole, D. Diazepam. Ans. Rosuvastatin inhibits HMG CoA reductase and lowers cholesterol levels. Q 890. A. Albendazole, B. Ciprofloxacin, C. Docetaxel. Ans. Albendazole inhibits glucose uptake in parasitic, leading to their death. Q 891. Which drug is used in bronchial asthma as a leukotriene antagonist? A. Montelukast, B. Salbutamol, C. Cefalin, D. Adrenaline. Ans. Montelukast blocks and decreases airway inflammation. Q 892. Which drug is used for emergency control of seizures? A. Lorazepam, B. Aspirin, C. Digoxin, D. Atenolol. Ans. Lorazepam rapidly enhances GABA activity to stop seizures. Q 893. Which drug is commonly used as an antacid? A magnesium C-pantoprazole, Ans. Magnesium hydroxide neutralizes excess gastric acid in the stomach. Which drug is used in bacterial meningitis? Third generation cephalosporin. A. Sfotaximi, B. Penicillin, C. Doxycycline, D. Gentamicin. Ans. Sfotaximi penetrates CSF effectively and inhibits bacteria. Q 895. Which drug is used for motion sickness and vertigo? A. Meclizin, B. Aspirin, C. Metformin, D. Omeprazole. Ans. Meclizin blocks H1 receptors and reduces vestibular stimulation. Q 896. Which drug is commonly used in hypertension as a beta blocker? A. Tiprolol, B. Salbutamol, C. Dopamine, D. Adrenaline. Ans. Metoprolol selectively blocks beta 1 receptors, reducing cardiac workload. Q 897. Which drug is used as a uricogenic agent in gout? A. Probenecid, B. Allopurinol, C. Ibuprofen, D. Aspirin. Ans. Probenecid increases uric acid excretion through the kidneys. Q 898. Which drug is commonly used as a topical antiviral agent? A. Acyclovir, B. Fluconazole, C. Metronidazole, D. Amoxicillin. Ans. Acyclovir inhibits replication of herpes viruses. Q 899. Which drug is used in emergency cardiac arrest? A. Adrenaline, B. Atropine, C. Verapamil, D. Ans. Adrenaline stimulates cardiac activity and improves coronary perfusion during resuscitation. Q 900. Is used for osteoporosis to increase calcium absorption. A vitamin D, B. Aspirin, C. Metformin, D. Diazepam. Ans. Vitamin D enhances intestinal calcium absorption and supports bone mineralization. Q 721. Which method is used for tablet preparation? A direct compression, B. Wet granulation, C. Dry granulation, D. All of these. Ans. All of these. Q 722. Which excipient is used as diluent? A. Lactose, B. Talc, C. Peg, D. Gelatin. Ans. Lactose. Q 723. Which instrument is used to measure hardness of tablets? A Monsanto tester, B. Friabilator, C. Dissolution apparatus, D. Autoclave. Ans. Monsanto tester. Q 724. Which dosage form is used for local skin action? A. Ointment, B. Injection, C. Tablet, D. Capsule. Ans. Ointment. Q 725. which is used as preservative in injections, a benzyl alcohol beta-C lactose depeg uns benzyl alcohol. Q726, which is used as isotonic agent, a sodium chloride beta-C peg D lactose uns sodium chloride. Q727, which is used as buffering agent, a phosphate buffer beta-C peg D lactose uns phosphate buffer. Q728, used as suspending agent, A acacia B alcohol C tal D peg uns acacia. Q729, which dosage form is used for nasal route, a nasal spray B tablet C capsule D injection uns nasal spray. Q730, which is used as propellant in aerosols, A LPG water C alcohol D tal uns LPG. Q731, which is used for sterilization by filtration, a membrane filter B autoclave C dry heat D radiation uns membrane filter. Q732, which is used as emulsifying agent, a span 80 B tal C lactose D peg uns span 80. Q733, which dosage form is used for rectal route, A suppository B tablet C capsule D syrup uns suppository. Q734, which base is used for suppository, a cocoa butter B tal C peg D lactose uns cocoa butter. Q730, which is used as humectant, A glycerin. Q736, used as thickening agent, A carbopyl B tal C lactose D peg uns. Q737, which is used as ointment base, A petrolatum B tal C lactose D peg uns petrolatum. Q 38. Which dosage form is used for inhalation? A. Aerosol. B. Tablet. C. Capsule. D. Syrup. Ans. Aerosol. Q. 739. Which is used as binder? A. PVP. B. Talc. C. PEG. D. Lactose. Ans. PVP. Q. 740. Which is used as lubricant? A. Magnesium stearate. B. Lactose. C. PEG. D. Gelatin. Ans. Magnesium stearate. Q. 741. Which is used as disintegrant? A. Sodium starch glycolate. B. Talc. C. PEG. D. Lactose. Ans. Sodium starch glycolate. Q. 742. Which dosage form is injection? B. Tablet. C. Capsule. D. Syrup. Ans. Injection. Q. 743. Which is used as oxidant? A. BHT. B. Talc. C. Lactose. D. PEG. Ans. BHT. Q. 744. Which is used for particle reduction? A. Ball mill. B. Autoclave. C. Dryer. D. Filter. Ans. Ball mill. Q. 745. Which is used for mixing powders? A. Double cone blender. B. Autoclave. C. Dryer. D. Filter. Ans. Double cone blender. Q. 746. Which is used as agent? A. HPMC. B. Talc. C. Lactose. D. PEG. Ans. HPMC. Q. 747. Which dosage form provides immediate release? A. IR tablet. B. SR tablet. C. CR tablet. D. Capsule. Ans. IR tablet. Q. 748. Which is used as preservative? A. Parabens. B. Talc. C. Lactose. D. PEG. Ans. Parabens. Q. 749. Which is used as surfactant? A. Tween 80. B. Talc. C. Lactose. D. PEG. Ans. Tween 80. Q. 750. Which is used as vehicle? A. Purified water. B. Talc. C. Lactose. D. PEG. Ans. Purified water. 151. Which is used as plasticizer? A. Glycerin. B. Talc. C. Lactose. D. PEG. Ans. Glycerin. Q. 753. Which is used as antidiarrhea? A. Talc. B. Lactose. C. PEG. D. Gelatin. Ans. Talc. Q. 754. A. Saccharin. B. Talc. C. Lactose. D. PEG. Ans. Q. 755. Which is used as flaring agent? A. Menthol. B. Talc. C. Lactose. D. PEG. Ans. Menthol. Q. 756. Which dosage form is biphasic? Emulsion. D. Solution. C. Tablet. D. Capsule. Ans. Emulsion. Q. 757. Which is used as buffering agent? Acetate buffer. B. Talc. C. Lactose. D. PEG. Ans. Acetate buffer. Q. 758. Which is used as stabilizer? A. EDTA. B. Talc. C. Lactose. D. PEG. Ans. EDTA. Q. 759.